Canada's vast land is beautiful, but a lot of it is uninhabitable. That's why most Canadians live in the warmer South, near the United States border. Since its founding in 1867, Canada has grown into a wealthy, advanced, and culturally diverse nation, speaking both English and French. Like many countries, Canada has a universal government-run healthcare system. This means that Canadians have fewer options for treatment and wait longer for medical care than people in other advanced countries. Instead of paying each time to see their doctor, all Canadians pay high taxes to fund the whole system. They've been convinced that it's better that way. But is that really the case?
I got a friend of mine who's in Toronto. He was diagnosed with shingles and was complaining about having to pay $100 for medication. Which because there is depending on which province you're in, you have different medical systems. It's not completely free. So,
the doctor's visit's free, but the medicine, because this is like a long-standing thing that like the NDP has been pushing for in Canada to have pharmacare. In other words, to not just have their existing Medicare system is what, is like, so nobody's charged, nobody's given a bill at the hospital or the doctor's office. But you do still have to pay at the pharmacy, which the Canadian left wants to change.
Yeah, and there are actually fees and stuff that you do actually have to pay, depending again on province. Because when the system was set up, there was a guy who actually went from province to province, petitioning to make universal health care. And I'm blanking on his name, but that's was it Joey Smallwood, I think his name was, and went from province to province to get this done, which is kind of interesting way to do it. We need like a Joey Smallwood of America, going from state to state.
Yeah, I mean, look, a long-standing complaint of mine is that certain political pundits who live in the same city that I do never seem to talk about efforts to enact single payer in California, even though they make a big deal of saying that they care a lot about Medicare for all. But yeah, I do just want to say before we resume the video on the taxes point, once again, the point about comparison is important. So it's yeah, sure. You're the whole idea of universal healthcare is that you're universally paying for it, through progressive income tax. And then it's free, or, and, maybe in the case of some, provinces, mostly free at the point of service. But as with the other videos, the question is comparative, right? It's yeah, okay. But it's which is actually going to cost you more? And people may recall that during, when Bernie Sanders was running for president and he announced his Medicare for All plan, the Libertarians, the Mercatus Center, did a study where they were fear-mongering. They put out a paper fear-mongering about how much it was going to cost. They did the thing that people like that always do, where they gave you the cost over 10 years instead of year by year, so you could move the decimal point one over. I've never understood why 10 years was the acceptable unit for that. I mean, it's man, you really want to make the cost scary, just tell us how much it's going to cost over the next century. But in any case, that Mercatus report accidentally found that it was actually going to cost, it was actually going to be much more cost effective than the existing private healthcare system. And everybody seems to agree. I mean, this isn't even a disputed point that if you're a middle income taxpayer who currently has private health insurance, then the cost of copays, deductibles, premiums is much greater than the increase in taxes, from Medicare for all. So it's you're still, you're paying less. It's just that what you are paying is a tax and not something, that you're paying to the government, and not and not a premium copay or deductible that you're paying to a company.
Yep, it's all true. Let's see if they mention Canada.
Any of that.
Really quickly, one more thing, because they said Canada's ethnically diverse, and that wasn't true until 1970 or 69, whenever Pierre Trudeau, the father of the current prime minister, actually opened up immigration to around the world. So a lot of Canadians that are ethnically diverse. We're talking first generation Canadians. Now it's not like here where we have like people going years back, and not saying that
it's not cool, Andy. You're not counting. You're not counting the diversity from French people.
Oh yes.
Let's see if they mention that Canada has a life expectancy that's 4 years above us. Usually when that, I think Ben Shapiro blames the fact that we eat unhealthy food in America.
Which is fucking amazing if you've ever been to Canada.
Poutine? I mean, come on, poutine?
Yeah.
I mean, this the country that has like 3 donut shops on every block.
Let's see what they say.
This is Marcel. He lives in Toronto with his parents, Aline and Fran. Marcel is a huge hockey fan, and he loves playing online computer games. In his free time, he even designs his own games and posts them online for people to play. His dad, Alan, is a software engineer and has been teaching him how to code. This fall, Marcel will be going to a high school with an advanced technology program. He's excited for the computer programming classes that will prepare him for college and hopefully a career in Toronto's tech industry. Marcel and his family are proud Canadians. During the Olympics, Marcel hangs the maple leaf flag in his window and joins his parents to cheer on his country.
That's not pot?
Marcel's grandpa Henri, who died when Marcel was very young, also spent his life in Canada. After serving in the Canadian Army during World War II, Henri worked as a construction site manager and raised 2 sons, Aline and Marcel's uncle Jacques.
I'm kind of looking like
After
Henri right
Henri's
now.
death, Jacques moved to the United States, where he works in the biomedical industry. Marcel wonders why his dad and uncle don't talk very much. Recently, his mom explained that they started arguing after Grandpa Henri died from stomach cancer. Jacques thinks that if Henri had traveled to the United States to see a specialist and have surgery instead of waiting in Canada, he would still be alive. He thinks America's privatized healthcare system is much better than Canada's universal one. But Hélène disagrees, and the brothers had many arguments. Marcel isn't sure why Uncle Jacques doesn't like universal healthcare. What's wrong with a government-run system that treats everyone for free? Marcel knows his family pays a lot in taxes, but that's normal in Canada. And what's wrong with waiting weeks or months when you need to see a doctor? That's normal too, right? To find out, Marcel is investigating the differences between American and Canadian healthcare, and he's discovering some interesting things. American healthcare is privatized, which means that, in most cases, people and their employers pay for it, not the government. American healthcare is very expensive, but the quality of care is among the highest in the world. Unlike Canada, the US has a higher number of specialist doctors compared to general practitioners. It also has private clinics where people can pay for treatment and enough X-ray, ultrasound, and MRI scanners to go around. When the doctor orders an important test, Americans don't wait for months like Canadians. They get that test right away. Marcel learned that the United States is a great place for innovation.
This is sick. I mean, first of all, yeah, they admitted that it's really expensive, but it's high quality. So what happens if you maybe don't have the fucking money that you need to have to pay for I can't believe they even admitted that. I mean, it is really expensive. I agree with them that if it's, that if you have a lot of money, you can probably get good care here, but maybe
it's a highly unequal system.
I mean,
people with a lot of money get very nice things in this country, and everyone else gets fucked.
I mean, what about like? I mean, I've I've gone through periods of being like unemployed, and then you don't have healthcare through your job anymore. So then I fucking waited to go to the doctor, right? Because I couldn't afford what I used to be able to afford when I actually had employer health insurance. So I don't know, the idea that yeah, you have to wait until you have more money or you save up to get a procedure. You know what I mean? I mean, there's tons of times in which I've waited because I don't have the money anymore. I don't know. I just think it's
absolutely.
It's really absurd.
This whole thing about waiting times too. I mean, I've always thought there was something like really obscene about this argument. That if you say waiting times for certain things, specialists are too high, and you should pour more money into the system so you can hire more specialists. I'm all for that, but like the contrast to the United States, I mean, there's something like really morally grotesque about this. It's like, yeah, you're right. You don't have to wait as long in the United States because you'll find that waiting times are shorter when you kick people out at the line because they can't afford to pay. It's like, yeah, when everybody is allowed to see the doctor, you're going to get more people in the line, and thus it's going to take longer than if some people never see the doctor at all because if you don't have if you have something that might be cancer and it might be nothing, and you are worried about how you're going to be able to afford it being looked at, then I mean, everybody knows people who've gone through this experience that's like that. People will roll the dice and be like, oh, all right, well, it's probably nothing, so I'm not going to go in and spend a lot of money I don't have.
Yeah, I mean, even conservatives at this point are admitting that United States, didn't Kirk in your debate with him, even he kind of admitted that there were problems with the United States healthcare system, but they blame a lot of weird stuff, right? Like too much regulations. I mean, it's just becoming ridiculous to the point where like what percentage of people's interaction with the American healthcare system has been like universally good. You know what I mean? I think there's just too many people that have been frustrated at this point, unless you're probably in like, maybe the top 20% or something of income brackets. I think most of us have. That's a super ad hoc guess. But my point is I just think most people, even if you're not super rich, have had negative experiences.
No, I think that might actually be too generous. I think that I think there are a lot of people who are, I mean, I think you could probably be in the top 20% of the income distribution and still worry about being medically bankrupt in the American system. Yeah, Charlie Kirk's big suggestion for what could be done as a non-socialist fix to the American healthcare system would be mandated price transparency, which is okay. One, still violates the sacred laws of the free market, right? You're still forcing companies to do something. But two, I always like whenever I hear this, like, I really want people to think this through. Like your appendix is about to burst. You're being like they've put you in an ambulance. You're on your way to the hospital. So, how much does this one charge? I don't know. Where's the nearest other hospital? I want to price shop a little.
Yeah, they just drive you from hospital to hospital in the ambulance.
Yeah, checking the, yeah, it's like driving around trying to find a gas station with cheaper gas.
Well, you're probably in a fucking Uber anyway because you can't pay for the ambulance. So I guess just change the destination on your Uber as you're checking prices. It's a utopia, is what it is.
And just another small thing: why do these people in Toronto have French names? Because like Toronto and mostly in Quebec, like there's a bit of a rivalry between the two, and if I had some friends who moved from Quebec to Toronto, and they anglicized their names so they wouldn't be as French. They do want to be Francophones.
I was just assuming this was taking place in Quebec. I didn't even realize.
Yeah, no, they said Toronto at the beginning, and I'm sitting here.
I think maybe Prager you doesn't know much about Canada. I'm beginning to suspect that.
They really make me like the Canadian father. He's like he's like a bearded computer programmer.
Yes, but wait. You just wait.
Okay.
We're gonna see what happens to him.
Let's see.
Yeah. I just like this is again, Canada has a higher life expectancy than the United States. So, if the big concern is having to wait longer to see a specialist, it's the rate at which that's killing people has got to be lower than the rate at which getting to see people eventually, when you wouldn't be able to see anybody in the United States, is saving them. It also has lower infant mortality. It also has much lower the sort of best stat to look at. I actually wrote something for Current Affairs about this a few years ago, is something called mortality amenable to healthcare,
right,
which is stats nerd speak for people who lived, people who died because they didn't see a doctor, which is obviously much lower. But yeah, sorry, we are coming up to time, so let's finish this one up.
Medical research and new technology. In Canada, taxes and regulations make innovation difficult. But with low taxes and free market competition, the United States leads the world in developing medical technology that saves lives. That's why Uncle Jacques moved to the United States. He wanted to study biomedicine and work in that field with the government out of the way. Lately, healthcare has become an even bigger headache for Marcel's family. Demand for treatment remains high in Canada, but there are fewer doctors and nurses than ever. So it's been a long time since anyone in the family has gone for a checkup. What really worries everyone is Alain. He's had nonstop pain in his stomach and lower back. Alain finally scheduled a doctor's visit, but he had to wait several weeks for an MRI test, and the family is still waiting for the results of a biopsy.
Can you make money by mailing people money? Sounds weird, right? Well, my students and I have delivered hundreds of millions of dollars to thousands of people.
that I was not expecting that.
Yeah. Okay.
Marcel is discovering that free healthcare comes with hidden cost. In a healthcare system paid for by taxes, there's a limited number of doctors, hospitals, and high-tech machines. Because no one can pay for their own machines or medical treatment, the real cost is having to wait a very long time. When someone needs a major operation like back surgery or has life-threatening stomach cancer like Grandpa Henri, waiting months for surgery means unbearable pain, and even the difference between life or death. This is why Canadians make over 200,000 trips outside their country for medical procedures each year. They travel to places like the United States, where they can pay for immediate treatment that will improve or even save their life. Marcel is worried. If his dad needs surgery, how many months will he have to wait to get it? When Marcel asked his dad if he would ever consider taking the family to stay with Uncle Jacques in the United States, where he could see a doctor and have surgery immediately, Alain said no. He claimed it would be too expensive and that it would cause Marcel to miss school and lose his spot in the computer programming class that he is so excited about. It's true that Marcel would be disappointed to miss out on his classes, but his dad is far more important to him. From all his research, Marcel is sure that treatment in the United States is the best option, even if Alain still believes that Canada's government-run healthcare system will take care of him just fine. When the biopsy test finally came back positive, the entire family was crushed to learn that Alain had a stomach tumor. He went to Ontario's healthcare board to ask for immediate surgery, and they scheduled it in 5.5 months. Alain's pain was already so bad, and there was no telling how much worse the tumor might get in 5.5 months. Marcel didn't want his dad to end up like Grandpa Henri. One evening, when he was designing a game to cheer himself up,
Why is the photo from the war?
Marcel found a solution, but he'd have to make a sacrifice. The next morning, he spoke to his mom about it, and then he called the school with the computer programming class and told them he would not be attending in the fall.
He's like about the same age as
first,
his mom.
Alain was very upset. He knew Marcel worked hard to earn his spot at the school. But Marcel said he'd much rather give it up and live in the United States for a bit, if it meant his dad could get surgery right away. Uncle Jacques immediately agreed to host his brother's family and help him schedule the procedures he needed. Now, Marcel is confident. He knows that with immediate surgery, his dad's chances of making a full recovery are very high.
Is he gonna die?
And while Alain still believes there are some good things about Canada's universal healthcare system, he's proud of Marcel for doing the research and making a tough decision. His son's sacrifice gave him the push he needed to travel for healthcare without shame, like many other Canadians.
I mean, they can afford it in that apartment because Toronto's rent is expensive. That's a nice pad they got there. That view.
I mean, everybody has the funds to take a trip to America and pay for an extremely expensive surgery when you're not on an American healthcare system. So you're paying for it. When you're paying for it out of pocket.
And especially since, our dollar's worth more than their dollar is, right?
I don't think it was clear why Marcel had to not go to school so that his father could have his surgery in America instead of his father just going and
No.
I just mentioned the one thing that really irritates me because Thomas Sowell does this too, where they say, Canadians, you know how many hundreds of thousands of Canadians come to America for health, for care each year? And they never mention that the number of Americans who travel abroad for affordable care each year is in the millions. There's an entire village in Mexico, an entire town that's the dentist town across the border. It's just a town full of Mexican dentists that Americans go to because they can't afford to go to the dentist in the United States of America.
I want to see a sitcom set in that village. I feel like that would be fun vibes there.
Yeah, I mean, I lived, I just spent earlier this year 6 months living in Rosarito, right across the border from the United States. And yeah, downtown Rosarito, there's a pharmacy with like a giant sign in English saying meds for less, because people are constantly going down there, to pick up cheaper pharmaceuticals. So yeah, I mean, this is but again, the fact that you can, if you have enough money, then traveling to the United States lets you skip ahead in the line. Nobody denies that, right? And that's for specific people who that describes, sure. Yeah, that's, they're getting, they're getting a benefit out of the American healthcare system. But if we are going to talk about if we're going to talk specifically about if we're going to talk in more general terms about the Canadian healthcare system and the American healthcare system, the stats seem pretty clear. They are getting more bang for less buck in Canada. In fact, as the Current Affairs Guide points out in the section on this, the United States spends way more of its GDP than Canada does on healthcare, and you have and there's nevertheless, right, again, higher life expectancy, lower infant mortality, better mortality amenable to healthcare. And by the way, I mean, maybe it's just that not enough Canadians have watched PragerU videos, but there is a reason why even conservative politicians in Canada don't run for office on a platform of privatizing Canada's Medicare system and moving towards something like the US system, because they would never win another election again, because that is a wildly unpopular position in Canada.
Yeah, and we are constantly mocked for our healthcare system in Canada. That is Canadian media right there.
Yeah.
I mean, and this is all in the context of America being the richest country in the world in terms of like GDP. I mean, having the largest economy in the world. Canada has the 9th largest economy in the world, at least according to the stats I'm seeing. So America has, baked in advantages for things like life expectancy and stuff like that, and it's still losing to, not to mention a country like the life expectancy in a country like Cuba, right? Which just shows how absurd it is. But the United States should really be doing a lot better on this if it wasn't for our healthcare system.
Yeah. No, exactly. Given the amount of money that's spent. Also, by the way, when they talk about medical innovation in the United States, that's not entirely wrong, but it is incredibly misleading, right? That's not the free market doing that, right? That's the NIH doing that. This is if you actually break down the numbers for pharmaceuticals, that what you really want to look at are NMEs, new molecular entities. So in other words, it's not some pre-existing drug that was changed in some incredibly superficial way so a different company could slap its brand on it. But is like a genuinely new drug. The overwhelming majority of those were developed in publicly funded labs. So it's like this is not a, that point about medical innovation, they're just not making the point that they think they're making. Nathan, any final thoughts about Marcel?
Just to point out that the Marcel video there is one of those that is explicitly targeted to kids for schools. There's a workbook that they have that goes along that's been specifically designed to guide you through the Marcel video with discussion questions and all sorts. So there's a whole book that goes with it. That they're trying to get into classrooms. It's a really, truly insidious propaganda effort, as much as I like to laugh at it. Ultimately, what they are trying to do is really sinister and evil. And so, the reason that Current Affairs put together the Current Affairs Guide to Resisting PragerU Propaganda is that they are working around the clock with their 100 staff to put out more and more and more of these. And of course, the video is 8 minutes and it takes us, half an hour to debunk it. And I'm very, very worried about this propaganda war and how well they're doing at it.
Yeah. Well, people should pick up the booklet. We have an order link in the description for the video that you're watching right now. It's fun. It makes a lot of basic critical thinking points about what to look out for when you watch these videos. The Frederick Douglass one that we didn't watch is truly insane. That's their kind of their inability to the moral clarity they bring to China, bad. One would think that slavery would be a very easy call, but that they seem to see more complexity in. It's odd. I don't know what to say about that.
They're moral relativists when it comes to slavery and slavery only. Different culture, different time.
Yeah. No. Like the Canadian healthcare system is awful because you can't skip to the head of the line if you have more money. But slavery, it's
who's to say?
It's
so
complicated. That's there's a this shouldn't be too judgmental about that one. You have been watching free public content from Give Them an Argument. To access every single episode of the show, the main show on Monday nights, all of the streams, all of the debate breakdowns, all of the patron-exclusive postgames on Monday nights, all of the patron-exclusive bonus episodes every week, and much, much more, go to patreon.com/Ben Burgis. I cannot resist ending this with, don't be foolish.